So let us start. I think it's visible fully. So the end of my miasms, chapter 26 to 33, we will try to complete this book. So these are the chapter which are practically useful. Dr. Vijaykarsir had been given a marvelous gift that how to treat advanced pathological cases by those chapters. My introduction, I myself, Dr. Vimal Raj. I compiled the work from Vijaykarsir. So I initially remember my guru, Dr. Rugani sir and Prasant sir. Then let us tribute our masters, Dr. Haniman sir and Vijaykarsir sir. Chapter 26. So this chapter that denote us about defense from birth to the death, the initial area of our life. If we talk about the first phase of our life, that is from birth up to the 20 years of age. In those days, most of time the person use the psoric defense, and we encounter the disease which are moreover psoric in nature in our clinic from child to the 20 years of age. So definitely got the cases like gastritis, like tonsillitis, like appendicitis, or few of having dermatitis. So these are type of the initial defense work that is more active in those days of life. So here Sora stands for learning, growing, working to gain knowledge. And that will be essential for a person to make him and his family survive and the satisfy basic need of life. So we knew that the child learn, grow, try to develop, cognitive function, try to develop different types of the healthy defense mechanism, sometimes unhealthy and they fall sick. But whatever the area in this life that is to gain extra, gain knowledge. And that is a sora in us. It is a first defense. And here the basic need is like a survival, satisfaction for the initial purpose of our life. Defenses that a cell or body uses essentially and purely physiological. So the physiological disturbances are more in those days. And the second phase of life, that is 20 to 50 years of age, where the second defense starts. And one need to proliferate in all their aspect of the life. So we start to progress. We start our career. We start to gain the name, fame, money, prosperity. We try to increase our or expand our area. And now we try to find out luxury, some amenities, some prosperities. So it is a kind of accumulation. So here the second defense works, and you encounter the most of disease in those ages, the patients of 20, 50 years of age. We knew that the most of the patient having diseases like PCOD, like that of hyperlipidemia, some kinds of the warts, some kinds of the extra growth in their body. They develop the hypertension, some develop diabetes mellitus. So the psychosis defense is more active in those days. The disease which we acquire are also due to the constitution changing the defense at the cellular level, the shift of gear from SORA to psychosis. That's why the most of the patient are of those kinds. Now the third phase, that is after the 50 years of age till the death. Here in this stage, it is characterized by the catabolism. So it is a rule of nature, rule of life. The one who born, he definitely died one day. And everything which starts to progress that ultimately start for the destruction. So every construction has to be a destruction. That is rule of universe, rule of life. So we have a patient in those days which we encounters like a patient got myocardial infarction recently, some develop paralysis, some develop some carcinomatous changes, some develop gangrenous condition. So those diseases are destructive then because constitution change the defense from psychosis to syphilitic mode. But one should remember it is a general level, a basic concept, but it is not a thumb rule. It does not mean in child you will not get cancer. It does not mean in young age you will not develop the hyperlipidemia or carcinoid or some kind of destructive changes. What the difference that is coming from generation to generation, that is also important. That is we also understood from generation to generation, from gene transference, what we get might get you are a patient of say for example type 1 diabetes, insulin dependent, where there is a agenesis of a beta cell or destruction of beta cells. So from very young age syphilis is active. So this aging process, which depends upon genes and telomere, that is end part of the genes, that is telomere, which carries some messages. Telomere has function, which varies with individual subjects. So it can vary. But we are generally what we're getting that had been given in this chapter. We try to focus more on some practical chapters. And now we go for the next chapter. In next chapter, Sir had been said about miasm and Herring's law of cure. So we knew about the Herring's law of cure, above downward, within outward, more important to less important, center to periphery. But Sir had been added one corollaries, added one more area in this Herring's law aspect that we one should remember in each and every follow. That is from more destructive miasm to less destructive miasm. That means your patient should go from syphilitic to psychotic mode or psychotic to soric mode, or maybe from syphilis to directly soric mode. That depends on case. But it should be from more destructive, deeper area to the less destructive miasm. Then, sir had been given example one case of leukemia. Then, in initial prescription, the patient having a WBC decrease, but at the same time his HB also decreased. Then Sir said it is a wrong follow. Why? Because HB is a soda. It is a basic thing. It is a basic nutritive thing. So HB should not go down. WBC going down in case of leukemia, it is a good thing. It is a positive sign in case of cancerous condition where there is a too much WBC. But simultaneously, when HB went down, that is a deficit of nutrition. The SORA should not go. So that's why sir changed the prescription. And after second prescription, WBC also initially increased, then HB also increased. So HB increase is a good sign. Though WBC increase, it is a bad sign for another conventional system. But later on, WBC again coming to normal and HB remain in higher side. So that is one example had been given. Then next example given, that is a case of neurofibromatosis where the patient developed renal stone. So again, sir said it is a good thing. Why? Because neurofibromatosis is a static psychotic changes. I think you know about neurofibromatosis, where the tumorous changes are fixed from the years together. So after the medicine, patient develop renal stone. So renal stone is a mobile psychosis. This psychosis have a route to expulsion. That's why he considered is a good sign. And another example given, that is a case of hypertension where the patient initially having a lower diastolic pressure and then systolic pressure moves upwards. So if one go for the conventional practitioner and systolic blood pressure is on the higher side, they definitely increase the dose of antihypertensive or they change antihypertensive to higher level. But here the diastolic goes down and systolic increase. So sir said it is a good sign because systolic is to provide nutrition to the end part. That is a sorry. While diastolic having direct load on cardiac muscle. So it is a psychosyphilitic. So diastolic goes down, those systolic increase. That is a good thing because you shift the gear from the more destructive miasm to less destructive area. So then ultimately in the case further the systolic again going down and the case improved with the homeopathy. And the last case where one lady had got a threatened malignant changes in uterus, too much fibrous changes, fibro tumor in the uterus. After prescription, that lady developed hypertension. And sir here said yes, it is a good sign. Why? Because those are pre-malignant changes in uterus, and she was suffering from too much dysmenorrhea, menorrhagia, metrorrhagia, and she improved, and blood pressure increased. So it is less destructive. And then later on, this patient who is ardent to the homeopathy, stick to homeopathy, her blood pressure also came down, and she improved with homeopathy in all her complaints. So that is in the chapter number 27. Now, chapter 28. A very useful chapter in our practice. That picking up of the right rubric for the simillimum with the help of the miasm. It means constitutional react as per the defense, as per the miasm. The sir had been given one nice example that, say, for example, one person who is master with swords. He knew how to fight with the swords. He knew the different techniques how to fight, and he killed the enemies with the help of swords. And he is in the right now more with fighting against the someone, and you give him a gun, and what happens? Of course, gun is a somewhat more technical weapon, higher side, but he do not know how to operate. And what is the use of that gun? You should give him a swords because he's a master in swords. So that sir had been given example. That means in our practice, patient using one defense is my. So we should give medicine as per his defense. Then and then he can fight against the natural disease process. Then and then his vitality can perform better. That is a something that what he knew he is in expert. You should give. So what he requires to be given is a weapon which is an expert with which he can use better. Maybe gun, knife, or swords. That is something like that. So our medicine should be as per the patient defense. So the next question comes that how to select the medicine. In homeopathy, we do not cure a disease. Our remedy do not cure a disease either. We only stimulate process. We only stimulate patient and patient's own vitality, patient's his own energy. It comes in such a mode after the stimulations of homeopathic medicine, the patient's smooth journey towards the process of cure. So our medicine provides only stimulus, only a right stimulus with the help of the stimulus which can stimulate. And what is the right stimulus and how to find it? Right remedy, how to find it? So we have to know that what defensive tactics is in Excel. Then sir had been given different rubrics, which are soric, psychotic, and syphilic. So in case you should use the rubrics which are as per the miasm, as per the defenses. How then to select the right minimum according to the defense? That is the on the basis of mental makeup, physical makeup, general makeup, and disease makeup, all arising from genetic code, which should speak the same language or defense of the miasm. And remember, mind and body speak the same language always. The patient, suppose, are suffering from carcinomatous changes and inquired for the homeopathic treatment. Now, in the patient who is suffering from cancer, if he say something like that, I got irritated easily by slightest disturbance or slightest offense. I do not like this disturbance in my work. And someone says something to me which is not as per my wish, and I got irritated. And you select a rubric like irritability trifles on. That is of no use. Why? Because if he is using this kind of defense, then he should come with gastritis, maybe eczema, sorry, defense. Now he is in a carcinomatous changes. So you should find out, you should dig in the case that something is present in such a way. So this patient must have rage, may have a furious anger, may have a violent anger. These kind of things are present. In a patient who are suffering from some tumor or warts, you can get like a manipulation in the mind and body also. You can get fixed idea. That's why Tuja is a fixed idea and Tuja have warts. We knew that. So the as per the disease, you have a mind and body. The patient who are suffering from gangrene maybe have some kinds of the syphilitic thing in the mind also. You should definitely find in your case. And on the basis of that, you should select your medicine. So what are the things you should consider? So in mental makeup, you should find out will, intellect, moral, diligence or non-diligence. What are the mental defenses? His sensitivity, his expressiveness. That means whether he's introverted, extroverted. We should understand disease makeup. And physical makeup, that means structure, height, weight, body, shape of face, hair, skin, etc. In general makeup, we consider the tolerance maybe to sun, wind, moon, rain, some kinds of the external factor, and you should consider physical generals. And rubrics should be as per the case and as per the defense. That had been given this in this chapter. And there are the different rubrics you can read and you can go through it, in which sir had been classified nicely that which are the soric, syphilitic, and psychotic. So selection should be as per the case. And if you select a higher miasmatic rubric, that is a better thing. Say, for example, patient is in a soric defense mechanism, and if you select a psychotic rubric in those cases, then it is a good thing. If you have a syphilitic thing, then it is a very good thing. If you have a patient who are suffering from syphilitic disease, then try to find out more higher syphilis. And if the patient is suffering from some psychotic, try to find out syphilis. But you should at least go for the psychotic in psychotic cases. At least. We should not go for the basic thing. If you go in such a way that you select somewhat higher defense and you select as per the pathology, then you have a good prescription and there is a right remedy, right stimulus to cure the patient. Then the next chapter, 29, where he described about miasmatic reflection in disease, and that we have been already understood in the theory of suppression book. We already knew these things, where he had been given example in the skin disease like person who are in psora having skin disease like eczema or some kinds of the rashes, maybe psychosis may have warts. Person who are syphilis may have some kinds of the syphilitic cracks, deep ulcerations, spaghettinic ulcerations, this kind of the skin disease. Joints problem, rheumatic arthritis also have a three defense like psora, psychosis, syphilis. Initially inflammatory pain, then the accumulation in the synovial capsule, then the edematous condition in joints, and ultimately deformity. There can be also three aspects. Rheumatoid arthritis, ankylosing spondylitis, SLE, they can be syphilitic from very beginning. Why? They are autoimmune in nature, and it is a gun towards self. So they are from very beginning autoimmune and syphilitic in nature. Then blood disorder again can be soric mode, psychotic mode, syphilitic mode. Say for example anemia. Anemia just due to the nutritional deficiency, that is SORA. Anemia due to secondary pathology in body, that can be psychosis. Anemia due to the bone marrow suppression, or sickle cell, syphilis. So same way had been given example of different diseases, even in neurological diseases and in the psychiatric problem. Like in psychiatric problem, initially patient have soric defense and maybe anxiety or mild depressions. In psychotic mode, they have a grief from prolonged period of time, and in the syphilitic mode, they have OCD or schizophrenia-like symptoms. So these have been given in this chapter. Next chapter, very important, that is regarding the brain dominance. So we knew that the right and left cerebral hemisphere, they are present inside the skull, but both operate opposite side of our body. Why? Because there is a decussation of fiber. Reticular network is there. So right brain that control left side of body, and left brain control the right side of body. So on the basis of the this development, evolutionary changes, there are some kinds of the thing we can understand by the function of brain, and we can select medicine accordingly also. So left brain dominant people, that means whose control from the left brain, that means they are all right sided personality. So left brain dominant people are known to have some characteristics like they are logical, analytical, work oriented, they are result oriented, they are more positive, they are mathematical, they are money minded, calculative, language interested, and they are achievers. The left brain dominant people, the good examples, they are having good kinds of business skill. They are MBA management master, they are executives, they are supervisor, traders, engineers, electrical engineers, computer engineers, because where one has to use the calculation. Mathematician, leaders, radiologists, pathologists. Why? Because they have to consider each and everything in millimeter, and they have to measure everything with minor changes. They have to count everything. So radiologists, pathologists, physiotherapists, tourists and travelers. And right brain dominant people, They known to have characteristics like they are more of imaginative type, they are emotional, they are sensitive, sentimental, they are creative, artistic, poetic, spiritualistic, and maybe historical in syphilitic mode. So they are like artists. They can be good painter, they can be poet, musician, dancer, planner, architect, scientist, computer graphic. They have a commercial artist, the doctors and lawyers maybe. But Sir said the doctors and lawyer have to be both brain because one need to be artistic as well as scientific in prescription and in understanding patient. So because of the use of a logic and imagination both in the practice. On the basis of that, we can understand some medicines. The most metals like alumina, argentum metallicum, aurum metallicum, manganum, mercury, molybdenum, palladium, platina, stannum. These are right-sided. Those are right-sided personality. Because you know that these are most of our achievers and leadership quality medicines. The most positive remedies like arsenic, camphora, causticum, hepar, mercury, naxomica, sepia, most money-minded drugs. You know that the bryonia, calcarea, arsenic, lycopodium pulsatilla, sulfur. So these are right-sided. Something opposite, left-sided remedy. So here we have a sensitive medicines, which we have some emotional medicines group of. Like most of left-sided remedies are sensitive, historical, like argentum nitricum, asafoetida, SRM, capsicum, sina, clematis, crocus, graphitis, creosote, lachesis, miserium, phosphorus, sepia, sulfur. They can be oversensitive metals, though they are metals, but those metals are usually right side because they are having dominant personality. They are logical, but some metals are too much sensitive. That's why they also fall in the left sided, like cuprum met, stannum met, platina, zinc, ferrum. They are left sided because they are too much sensitive. Historical remedies like Ignatia, Valeriana, Viola odorata, Simicifuga, Crocus, Cyclamen, they are also left sided. So, in short, constitution which are full of work and thirst, that can be right side. And the constitution who are more sensitive and spiritual, they are left sided. But the warning had been given that these are only some hints which help as a pointer to the group of remedies, and to understand the relationship between miasm and remedies, one should not take these hints as a hard and fast rule. Why? Because some polycrest medicines, not some, but many polycrest medicines, you will find a in both sided affinity. If you go to the Boger-Bonning Gaussian's repertory, and in generalities, you will find the side which are right sided, which are left sided. Then many polycrest are there which are present in both with too much higher intensity, like sulfur, like lachesis, like pulsatilla, like bryonia. Sulfur, say for example, here given in both right and left. Argentum nitricum given in both right and left. So why? Because argentum on one side having performance, but nitrogen group, nitrogen give him more sensitivity. So that's why argentum can be right and left as per the difference, as per the miasmatic expression. Then the next chapter that is regarding genetics of psychosis. Try to understand this diagram. We had been learned earlier in the physiology in the first year that how the cell develop the mitotic changes, how the one cell that duplicates by 1 is to 2. So these are the phases that G1 phase, then S phase, which is known as interphase, then G2 phase, and mitotic division ultimately. So G1 phase has one checkpoint, then you can see at the G2 point again another checkpoint. So this diagram you should remember. The cell cycle comprised of basically two phases. Mitotic phase, where in cell are actually divides. One is to two. You know that the cell that one aspect of nucleus part this DNA that move towards the one north pole or another towards the south pole in all the divisions actually that is you can read from the physiology. So mitotic phase where actual division happens, Then the resting phase, where the cell prepare for the mitotic division, that is known as resting phase. There are basically two phases. Now the mitotic phase again consists of prophase, metaphase, anaphase, and telophase. The resting phase is also known as interphase, where a DNA replication takes place. The interphase is divided into three parts: G1, S, and G2. G1, that is a phase where cell try to monitor environment, try to monitor surrounding. So cell initially try to understand whether this environment is capable, this environment is supportive, whether nutritive functions are proper, whether the all the metabolites, hormones, enzyme I needed for the further process is in a proper amount, in a proper way. That is a monitoring of the surrounding. That is a G1 phase. So first this happens. Then second, S phase. Here, after G1 given permission, now you can go in the next phase. So the next phase start, that is S, where DNA replication starts. So DNA replication is ready for 1 is to 2. So they become ready right now. Then the next phase is G2 phase, where ensure about proper replication that allowed to proceed M phase. Now DNA replication already taken place in the G2, and cell is about to ready for the mitotic division, that is M phase. That means proper division. So we have a two checkpoint. One is at the G1, which control entry, whether the surrounding environmental area is preferred, is proper. That is entry for S1. So there is first checkpoint in G1. And then G2. That again another checkpoint, that is entry for the actual mitotic division. So we have a two checkpoints, G1 and G2. G1 control entry in the S, and G2 control entry in actual mitotic division. There are the certain cyclin dependent kinase. Now the problem happens in psychosis. What happens in psychosis? And further we understand what happens in cancer. Now certain cyclin dependent kinase, that is a kind of protein you can understand right now, namely CDK2. There can be another also like CDK1, 2, 3, 4, 5, but here we are talking especially about CDK2, which combines with cyclin E, that is another protein, let's say, that combines with cyclin E that help the cell to overcome G1 checkpoint or pass the checkpoint even if cell does not have proper growth. Suppose you are traveling through some area, some where there is a one checkpoint is there, and after some time, due to the forest area, the forest officer do not allow to further go journey ahead, and they restrict you for the further driving, and then you give some bribe to that officer, and then they allow. Yes, you can go. How many person, whoever you are, you can go and you can go journey. So it is something like that. So the mechanism where CDK2 plus cyclin E combines, it creates a thing, it manipulates and it governs the things in such a way that it appears as a there is a no problem. And that's why there is a crossing of G1 check. It happens. It should not happen, but it happens because of these two things, CDK2 plus cyclin E. So this probably the start of psychosis can be said as start of psychosis. Why? What happens? Because again, growth is not in control. If you are not having a proper mechanism, rule and regulations, there is uncontrollable growth. Simple. So here the cell tries to bribe its way or manipulates its way through the checkpoint, hence try to synthesize more DNA so that more than two cells are produced. And that is the phase of psychosis. This is the start of proliferation, excessive cell production, and excessive production or a synthesis of proteins and enzymes. And thus, probably the psychosis sets in. The psychotic constitution probably has a more of this CDK2 and cyclin E combination. It is said that. That means if you find out the person who has psychotic changes, maybe you can say too much obesity. In those things also you will find these combinations. CDK2 plus cyclin E, which makes the undergo multiplication or a defense by construction since birth. So it starts since birth. So this can be from very beginning. Psychotic constitution can be from generation to generation, same like other miasm. But it can be, and it can be acquired also. How it can be acquired? Suppose the person is suffering from psoric problem, repetitive sore throat, and he had been given too much antibiotics, antihistaminic, anti-allergic drugs. Then he developed the chronic sinusitis, maybe, maybe developed tonsillitis or adenoids. So suppression of initial defense, too much time, that again leads to this combination, that is cyclin E plus CDK2, and this leads to a psychosis. So it can be acquired, it can be congenital. The suppression of SORA that leads to the G1 checkpoint that can be overcome because of this suppression. So that can again happen. So though the cell is not prepared, not matured, then it moves towards the further growth. So in cancer too, it is the G1 checkpoint which has been seen to be defective. We can see same thing in the cancer. But one gene giving rise to the multiplication tendency, that is overcoming G1 checkpoint, is same as what is probably called as proto-oncogene. I will explain. One oncogene does not necessarily causes cancer. It requires minimum two oncogene to causes cancer in person. The presence of one oncogene stands for cancerous diathesis, which in other words may be equal to psychosis. The gene of proliferation is responsible to police the normal cell. And there is another gene that is called gene P53, which acts as a brake on excess cell proliferation. So same thing happens in cancer. But in cancer, what happens? The proto-oncogene that converted into oncogene. So proto-oncogene is a prior phase. That is a probability to converts into cancerous condition. And these kind of genes present in each and every one. And that's why it is said that all human being has a cancerous gene. It is said that all human being has many or maybe some cancerous genes are present in all of us. But those are proto and then converts into oncogene. But one oncogene is not responsible to cause cancer. At least two oncogene required to produce a cancerous condition. One oncogene can lead to cancerous diathesis only. And that nearer to the psychosis, one oncogene. You can say it is nearby psychotic changes. When the two oncogenes are there and some stimulus happens, then there can be cancerous condition starts. The stimulus starts. But nature had been given one thing, gifted one thing, that is gene P53, which is something to break that process. That's why we can survive. That's why we do not directly jump to cancerous conditions. And each and everyone has a cancerous condition. So we are affected by any exposure to too many oncogenetic substance. We are in exposure of too much chemicals, pollutants, some kinds of the addictions, but each and everyone do not suffer from cancerous condition. So what happens? That is known as a P gene P53. So what gene P53 do? It has been mapped to chromosome number 17. It is a location of gene P53 on chromosome number 17. In the cell, P53 protein that binds DNA, which in turn stimulates another gene that to produce called gene P21 that interact with the cell division stimulating protein CDK2. And when P21 is complexed with CDK2, the cell cannot pass through to the next stage of cell division. So it is something like that some superior authority, more higher police officer had been appointed to avoid bribe and to move you in illegal timing to get entry. It is something like that. So P53, what do? It works with the P21. And now P21 combines with CDK2. It works with CDK2. So that CDK2 that prevented to combines with cyclin E. And now, here it is a something like that of break, that do not produce too much multiplication, do not go with the too much cell division. So it is a P21 that now work with the CDK2 in place of the cyclin E. Now, mutant, what happens sometimes? There is a mutation of P53. So, mutant P53 cannot longer binds DNA in effective way. And as a consequence, the P21 is not made available to act as a stop signal for cell division. The cell divides uncontrollably and form a tumor. Suppose that higher officer, the senior officer who had been appointed to control the lower channel, he took the bribe, or he get some kinds of the thought process. What happens? We can manipulate. We can do something another way by this way. Then there is a no control. So it is something like that. When the mutation happens at P53, then P21 not allowed to work with the CDK2. And this is a case where uncontrolled division of cell happens and the tumor formation starts. So it is actual process happens in cancerous condition. Now the conventional system works on this area. The most of the medicines which are considered to be the anti-cancerous drugs, the medicines which can stop mutation, they work on those areas. They try to suppress this CDK2. They try to suppress the cyclin E. They try to stop the binding of these two things. And their medicines are most of work on this background. The gene of proliferation can be either inherited from parents or acquired during lifetime by the process of reverse transcriptase. And those who inherit it are psychotic constitution. So this proliferation can be from birth, from the parents, or can be acquired. So this happens in cancerous condition and the psychotic miasm. The genetics of the cancer, the partial things we had been understood in the previous chapter. Now the another thing, genetic mutation take place. There is a gene called P53 which acts as a brake on excessive cell proliferation, not allowing mutated cell to go in further cell cycle, and this prevents malignancy. When P53 gene is defective, that is when the cell brake fails and the mutated cell proliferate, that is the proto-oncogene that turns into oncogene. So P53 defective, it means protogenes, which everybody has, converted into oncogene. And two oncogenes are enough. The proto-oncogenes are genes that, what is proto-oncogene if you want to understand? That is, proto-oncogene are normally help the cell to grow, divide to make a new cell, so they are useful basically, or to help the cell stay alive. They are useful, they are naturally given. So when proto-oncogene that mutates, they change in their structure, and there are too many copies of it, then it can become turns into or activated into when it's not supposed to be at the point where it is called as an oncogene. So protogenes are good for natural growth, for the cell to stay alive. But when too many copies happens, then this proto-genes that converts into oncogene. The part of proto-oncogene that is replaced by reverse transcripted DNA that leads to the cancer. So what happens in the proto-oncogene? Some kinds of the DNA transcription happens that is mutated proto-oncogene, you can say, change. Now it can convert it to cancer. A reverse transcriptase is an enzyme. What is reverse transcriptase? So it is an enzyme that used to generate complementary DNA, that is cDNA, from an RNA template. The process terms as a reverse transcriptase. So what happens in reverse transcriptase? That the complementary DNA, it starts to generate. So in previous mentioned genetic mutation cancer, it is advisable to prescribe on phenotypic stimulus and not a genotypic stimulus. The change phenotypic stimulus is based on change in general physical, mental occurring after onset of cancer, which due respect to strong psychotic symptom which is not changed before or after. Now, for that things, you should understand what is genotype and phenotype. Anybody has idea about what is genotype and what is phenotype? So, sir said here that how to treat cancer cases, how to work with these advanced pathological changes cases, what you should consider. So he said about use of phenotype, phenotypic simile rather than genotypic simile in those cases. In those cases, he said that you should use phenotypic simile. So we'll further study what is genotype and phenotype. The phenotype stimulus, it is based on a present change in the general or in physical or in disease makeup. So it is a present condition in front of you, whatever the state is in front of you. That is phenotyping. So you should consider phenotypic things in those advanced cases. Why? Because the mutation already changed. It changed entire picture from very earlier things, from micrological level. The DNA replication, the mutation at the proton cogene already taken place. And now the basic constitution is already mutated, already changed. So that is not of such useful to prescribe. If you said we prescribe constitutional medicine in cancer, and we are talking especially about advanced cancerous conditions, where the constitutional medicine do not work much, not effective. Except you should give the some kinds of the respect to the psychotic symptoms which are present from very initial stage, even before the entry of cancer. Some kind of psychotic symptoms are present because what we understood as a psychosis, it is something like that of precancerous. It is a proton cogenes are there. Too much growth is there already. So it is a factor which is running from earlier things. And it is still present. If you find it, then you should give respect to them in the selection, but later on. The phenotype is what? The phenotype is a constellation of observable trait, and genotype is a genetic endowment of individual. Difference between genotype and phenotype. What is genotype? A genotype is a genetic endowment of individual. That means giving of a generation of one species to the next species, having some kind of fixed pattern that runs through this species in this race. So it is something like a genotype. But phenotype is what? Phenotype is a genotype plus developmental changes that is given by environment. It is phenotype. So phenotype is something different. Genotype can be say for example, the one can say that in my family most of the peoples are obese and everybody are obese. So even I got obesity because it is running from very earlier changes. So it is something like genotypic changes. But out of those siblings, one is too much fair, another is dark. One is too much chilly, and another is due to the too many disease condition, too much drug abuse, change their desire, aversion, thermal state. Can be phenotype. So you can have a genotypes which is having genetic endowment of individual which runs. But phenotype can be a genotype plus developmental condition that is from environment. And it is a constellation of observable trait. It means combination of observable trait in front of you. It is right now. Thus, in cancer patient too, the basic character of original constitution are not helpful to prescribe, Sir said. Each genetic alterations may causes phenotypic changes typified. When this mechanism is distorted, cell growth is out of control, means the defense mechanism has failed, break have gone down, and this amount of syphilis, and thus the cancerous is at the genetic level as a syphilitic disease. So try to find out present syphilitic condition, which is observable to you. So in cancer patient, if you go for more physical generals, that may be less useful. But if the patient said the cancerous growth is having a particular type of discharge, brownish discharge, say for example, or cancerous growth has some kinds of the uh, too much dark or the black discoloration, then it is a useful for the prescription. If the cancerous ulcer having particular type of border, That is useful for the prescription. But suppose these patients say, I like sweets too much, then it is a less useful. There is less importance should be given. When the patients say, after same patient, after some kinds of medication, he may develop the changes. That now my ulcer is somewhat less brownish, somewhat less darker. It is towards greenish. Then you may need a different medicine. So here, if you say on the basis of constitution, I am being selected this particular medicine A, and I am running this medicine in the same patient, so then the cure or the chances of improvement are very less. But one we prescribe on phenotypic changes, it may be physical, it can be mental. Then the chances of success is more in those cases. The change phenotypic stimulus is based on change in the general physical, mental occurring after onset of cancer with due respect to strong psychotic, which is not change before or after. You should give importance to psychotic also, some psychotic which are present throughout history from very beginning, even before the cancer. So if those are there, suppose this person is too much obstinate from very beginning, and you got too much hard tumor, which is fixed, which is cancerous, which is hard. So it is something that psychosis runs from very beginning. You should give importance at the physical and mental level, the tumor, hard, nodular, stony hardness. And you should take importance also to the rubrics that is obstinate. But suppose this patient develop the another kind of changes in the mentality, which is at the present, then again these things is phenotypic. So you should consider beside this obstinacy, with due respect to the psychosis, which is from very beginning, present till end. But there is another type of the cancer which are epigenetic. Another cancer which is epigenetic. It is something prior to cancerous changes. What happens in epigenetic? In epigenetic, you will not find this kind of too much mutation. In epigenetic, you will not find too much failing of break. But the cell or DNA somewhat change in their appearance. In actual structure, they are somewhat changed. And due to this differentiation, in biopsy, most of the oncologists they focus on the what are the changed cell pattern, what are mutated cell, which is what are cancer cell, which having not proper look than the cell of nearby area. Those are cancer cell, the deviated pattern. In biopsy, what they usually mention, and this epithelium should be like that, but right now it is a squamous, then it is a cancerous. So in cancer, in biopsy changes, usually they find out this, that is deviated, mutated cell pattern of that local area. So the changes which are somewhat changed in their appearance, genetic mutation, here actually do not take place, but only expression of genes somewhat change. It is a minor, or you can say superficial or earlier changes. But the most of the conventional system they consider actual cancerous condition and they do treatment accordingly. Here, we have a good research with homeopathy. Why? Because the basic trait is still present. So, in those cases, you have to focus on genotypic medicine, what we another name given as a constitution. In those cases, you can prescribe this, and in those cases, you can find out a same thing, the same pattern is present even before appearance of the cancer. And even those cases, you will find good result. Not in allopathy, not in homeopathy, but everywhere. Many patients survive who are having proto-oncogene. Like some lady who develop after some age kinds of the mammary glands tumor. Male develop some kinds of the prostatic changes, and they are considered as a pre-oncological change, prior cancerous condition. They do the surgery and take some kinds of radiation, and the patient survived. So they have a good result. And even in homeopathy, we have a good result in those type of the epigenetic type of cancer. So it is a prior. And here we have to focus on genotype, not the phenotype. Mm. That is a good thing I got from one book. The picture is in such a way. So here the actual thing about genotype and phenotype had been explained. So what is genotype? It shows the genetic constitution of living individual, while the phenotype is shows the external appearance of organism like size and color. Okay? As I said, most of these person of one family are obese. So all the siblings are obese, but one is too much having dark complexion. Another is lenient thing. Sorry, not lenient, but having fair complexion. So it remains the same throughout the life. Genotype runs throughout the life, and phenotype may change with the time and environment. It can modify. Genotype is not affected or influenced by phenotype, but phenotype is controlled and governed by genotype. It is governed by genotype. It can be established on the basis of previous history of offspring, while the phenotype becomes clear only on seeing a living being. You can get genotypic information from earlier species also. How many people who have a cancerous condition in your family, maybe maternal side or paternal side, that is genotypic information runs. But the squamous cell carcinoma, how many of family members develop? No one. This fellow only, patient only. That is phenotypic. So different genotype may have a similar phenotype. Different genotypes may have a similar phenotype, while different phenotype have a different genotype because phenotypes can be many, and that is in a different species, different races, different varieties we can see. Here you can say TT and TT both are of tall, but TT tall and TT dwarf. That is example classical. On the basis of that, you can understand what is genotypic and phenotypic actual thing, and in which case you should give genotype medicine, and in which case you can give the phenotypic medicine. Clear? Now the practical hint in chapter 33 had been given. We should observe each and every follow. First thing, whether we are going in right direction or we are in the wrong direction. Whether the patient is on a going towards the more higher layer, we are doing suppression, palliation, whatever. We have to follow the take the proper notice of each and every follow-ups. And miasm also should be given importance. The miasm should be less destructive. Then sir had been given many examples, and he had been elaborated about the abrodenum usefulness of the abrodenum in some cases. And even I had been practically uh, did these things in my clinic. When the patient came to you with some suppression, sudden check discharges. In materia medica, you will find about diarrhea only. But sir had been clinically verified that if the patient having history of any check discharge, suppressed discharge, you can use abrodenum. But he had been again said that we should use abrodenum here in repetition, many cases. Because what we do here, we are giving partial medicines only on the basis of some partial points. So one need to use abrodenum repeatedly, not in a single dose in those cases. Once the disease has settled down, that is inflammatory stage is gone, and the thickening or growth is sets in, the rubric elements from does not bear an importance. Very useful clinical tips. Suppose the patient have a history of diabetes since 5 years, and that diabetes started after loss of money in one business before 5 years. Initially, he developed the weakness. Initially, he developed some kinds of psoriatic complex. But here, elements is not as such useful. Why? Because Sora already passed. Psychos is already in journey. So you should give more importance to syphilis and psychosis in those cases. Now, elements factors are not as much use because elements factor leads to initially primary defenses. So in acute, why we give importance to elements factor? Because acute is having which miasm most of time? Sora or sorosyphilis. Acutes are soric or sorosyphilitic in nature. That's why in acute we should give importance to elements factor much more. When the patient is of too much changes, then the elements factor is not very important. The danger of MRI scan and biopsy, sir said, because it is a too much magnetic force, too much magnetic vibration that stimulates body fluids and it alters the cell structure and again settle down the MRI scan. And even with the help of biopsy, you are producing disturbance in the internal environment of cell. So I had been given example of one case of natrum carp here again, that the patient completely disturbed after the MRI scan. Then sir said about psychotic constitution, most of having prolonged stresses in their life. And that's why psychosis and that's why psychotic disease. You will find definitely a prolonged grief, prolonged kinds of the stress factor, disturbance in their life. Same way in syphilitic patient, you will find sudden changes and sudden disturbance and some kinds of the dangerous condition which develop suddenly. Next things are been given like grave disease, where if you are treating some grave disease, some more pathological advanced cases, and the patient who come with recurrent acutes, that consider is a good thing. Why? Yes, yes, you are moving towards the less destructive one. I remember one case. At one case, the boy around 3.5 to 4 years of age, the boy had this muscular dystrophy, and he declared that he will die after some years. And on consultation, what I got, mother said me clearly, sir, I knew that this is not from very beginning. Though the doctors are saying that this is from birth, it defects is from very beginning. But I can remember that when the child was about 3 to 4 months, and after 3 to 4 months, near about at the 3 to 4 months of age, he got too much fever, an acute condition, bronchitis, and we admitted that boy. And then later on, after the this treatment and all these things, he developed gradual weakness, and now he is not able to stand, walk. His grip is too much weak. The disease gradually progressed. And I can remember that before 3 to 4 months, the child easily try to grasp a thing, and the muscles are too much working, the limbs are working. I can remember those things. The child have a good muscular movements in initial days, and right now even not able to stand. So mother said me, I had been given one medicines, and after 1 month, the first follow-up was very good. The child improved in his muscle strength, tried to grasp the things, tried to hold things, and can stay for a few seconds also. Later on, after a few days, the same child got fever, high grade fever, and acute. And I had been given SF because I do not want to disturb the case. But his father, who is not too much believer, and he was too much anxious, and the anxiety may be given by some physicians that this child is developed too much fever, it can be problematic, or he develop epilepsy like that, etc. So he didn't wait for 2 to 3 days, and they shifted to another treatment where he had been given antibiotics and antipyretics and all these things. The next follow-up after 15 to 20 days, too much bed, whole thing worsens again. And now the same medicines which had been prescribed didn't work. Even I raised the potency, changed the potency, it didn't work. I referred the case to senior, and he said also that now it's of no use. Then ultimately we shifted this case to Amrisha. Then I don't know the story, what happened. But these things happen in your clinic. Recently we knew that the case, what we had been treated, and the girl developed acute, but we do not disturb. Because if the recurrent acutes in your too much pathological grave changes, it is a good thing. It is a good sign. Then sir had been given that is the cancerous condition, the patient. If you find out in history some kinds of the virus illness, so it is very good. And if they develop the some kinds of the warts in their body, then it is a very good thing. Because the most of the virus like chickenpox, herpes virus, whatever, rubella, cytomegalo, they are having psychosyphilitic tendency. They do not initially having too much prolonged psoric phase. With the mild psoric phase, they directly jump into psychosyphilitic mode. And once suppress these things, then patient can go into malignant changes in later on their life. And if you are treating those patients, and if they develop warts, then it's a good thing. Even in some lady who had history of changes, cancerous changes in breast or cancerous changes in the uterus or some tumors, if you do some tests like torch panel, you can find out some virus. If those patients develop the some kinds of the excretions in their body, what's extra growth, it is a very good thing. It means the virus toxicity that came out, which leads this psychosyphilitic defense. So the what is conclusion of all these things? Let came to conclusion, the time culture, the time frame that change disease chronology. We are the last part. In earlier days, if you go before 60 to 70 years, if you will ask to your grandparents, then they definitely say that our life were very simple. We are just at the village and we are going for farming or something work, very basic works, and they do not thought about too much luxuries. They are only work for basic need of life, and those are usually die with those psoriatic symptoms only. It's a minor infection and they died. Some kinds of epidemic that may lead to the death. But in those days, human race was in purely nutritive phase, and the man was trying to survive and make two ends meet. That is only basic requirement. They do not thought about too much changes or generation or the future things. Just work for the day to day bread and butter. They are having more of psoriatic disease, or they even do not have the too much grave pathological or psychosyphilic disease at the 90 years of age, even though smoke too much. We knew those things, those patients. Then later on, what happens in 20th century? Change starts, especially in European countries, and this was a spurt of discoveries and newer invention. And the most of the newer invention, most of the discoveries, maybe you can say the car, air conditioner, some kinds of the extra this mechanics, whatever. All these things to make our life more luxurious, more rich. Humans start to go for some kinds of mechanical work, and they decrease the labor. The luxury started, more kinds of the amenities started. So this luxurious life to show off, this lead to the era of psychosis. In those days also, what happened? There is a in the medical field, the newer discoveries and invention, the newer antibiotics and the vaccination had been this invented. It leads to the suppression of psoriatic defense. Do not allow SORA to manifest even by earlier vaccination. And human being move towards the psychotic changes, and you have a more newer disease where we say nowadays is a lifestyle disorders, diabetes, like hypertension, obesities, etc. started. And the mind also, the human psychology also turned the pattern. Now the more jealousy, more envy. I want to look better. All these things started. That was the in the 20th century. And then later on, in the upper 18th, men started to conquering unseen. We can say just before 20 years or 30 years. Men went to the extent of controlling electromagnetic waves, which he never sensed, were never gifted to see, nor control, nor was he made to capable by Almighty to use for any means. You can right now see what is happening in USA. You can right now do Google and see what is a place and where the one person is standing, one person is located in particular country, which is very distant. So men try to see what is unseen, which is not given or gifted by Almighty to do. Try to control the electromagnetic field. The evil started. And these things lead to the syphilitic changes, the syphilitic world, and the newer viruses. newer cancerous condition, new and new pathological advanced growth changes, and the more syphilis leads to the destructive changes even at the mind. We knew right now happening between this Iran and the Gaza. Yes. So that is massive destruction. Perversity at the mental level, psychosis, sexual perversion. In the very from the very early age, we can see the too much kinds of the psychosexual perversion. We are reading right now in newspapers what is happening in our surroundings. So it is a syphilis, it is a syphilitic world. Thus, the world moves in the circle, actually. That had been also mentioned in our earlier literature. Satyuj, Dwapar, Treta, and Kali, like this. So it is circle of Sora, psychosis, and syphilis that is going on. So that had been concluded ultimately, and we have a very nice thing by Sir given in this book that how to deal which kind of cases and what is the actual miasm, what is the defense. So we conclude your lecture. You can ask the question if you have.